everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. I know, right? Oh my gosh.
Celebrate good times. Come on.
Devin is hitting her paper with her water bottle.
We should have definitely brought something to
pop. Pretend like there's confetti.
There's confetti. I mean, come on, let's go. Where is it?
Shut up. Shut up.
What is that?
Okay, we have.
Narrate, Duckwall.
Okay.
Oh, nuh-uh.
Harrison is throwing us some popper confetti to celebrate.
If you're not watching, hop over to the YouTube real quick and watch because we're about to pop confetti.
I can't get into it, guys.
Give me help. I have long nails.
You can do it.
You can do it with my muscles.
Ribbit.
I can't,
That's embarrassing.
Don't you work out?
It's pretty intense plastic.
Every Tuesday and Thursday?
Wow. She's pulling with all her might.
Intense
Your
plastic.
face is turning red.
I can't do it. I can't do it.
No, don't give up.
Courtney,
Oh,
she
gave up.
I'm giving up. I'm giving up. What number of reviews, Duckwall, are we at?
We are at 254 on Spotify.
Yeah, over there, you two. You need two people. We're at, oh my God.
Woo, it's still
101. Can you even
on
believe
Apple.
We got it. That's literally tape. That's
We
why
got
I
it.
pull
No one
okay,
fret.
got it.
We went from 94 to 101. Good job, everyone.
Incoming. Now we have to
This
open
is
They
the
look like
amazing.
small fireworks.
Woopity
I'm kind of
whoop, whoop,
scared.
Boop, boop,
Watch
boop,
out,
boop.
y'all.
Are you doing?
Wait.
Hit it, baby. Woo!
Oh, no. Uh-oh, I did it wrong. Oh, no, I broke it.
That's exciting.
Another one.
Okay, that's amazing.
101.
254 Spotify,
254.
101.
Should we set our next goal or just celebrate now? And then
Let's
set-
just enjoy it. Let's
no.
smell
We
the
don't even know what we're
roses.
doing for
Let's
this
smell the
one.
roses.
Wow.
I can't believe it. Harrison was reading some of the comments when we were in the car, and they were like, "We're trying to get you to 100." It was really cute. They're like, "We know you'll make good decisions for Devin when you get to 100."
Oh, please.
You know,
Too
the
much
ideas
faith
we've
in
narrowed
that.
it down on are, I mean, pretty nice. I
Pretty
would say.
exciting.
Yeah.
I mean, it's a good thing I'm not in charge of it, right? Okay, so share. What are we doing? Are we sharing? Right?
we
We're
sharing?
You
sharing.
actually know what we're doing?
This will be news to me. So
For real, we know.
Yeah.
Okay. Well,
enlighten
the
me.
general gist, something for you guys to look forward to. The general gist of what we're doing is we are going out in public and having kind of like a trivia game, right? Is that
Yes.
okay?
Yes, asking
So
questions.
We're having like a trivia, like vet med related,
Yeah.
nothing crazy. And then we go up to random strangers, we ask them questions, and if you get it right, you get to pie Devin in the face
Yes.
Yep.
with whipped cream or something like that.
Yeah.
they get
Yes.
it right.
Yep.
Yes. I've been loading some questions into my brain. I have a good list.
So get excited.
Oh, this
So
is
we're
gonna
going to
be
have
exciting.
probably a wide range of difficulty questions,
Mhm.
but then we tossed around, where do we go do this? And so that's where we're trying to narrow down, like,
Yes.
which audience are we focusing on? Obviously, time and the schedule is a big thing too. So yeah, we'll have to
Mhm.
figure it out.
Yeah.
Stay tuned.
Yes. Yeah.
Stay tuned.
Locations,
Brush
stay
up on your
tuned.
veterinary technology and medicine knowledge.
We're going to promote the podcast and also have some fun with Devin.
Yep, because we got to 100 reviews, baby.
Woo! And obviously, we'll make a video of it. So stay tuned.
Yes,
Yes.
absolutely.
It'll be a separate video.
Mhm.
Obviously.
Mm-hmm.
All right,
Mhm.
who wants to read our new review?
New review. Okay. I constantly look forward to new episodes and recommend them to all my coworkers. Keep up the amazing work. I am proud of you all and thank you for sharing your experiences with us. People like you guys are what VetMed needs more of.
Oh.
At Molly W4444. At
Woo.
4 4.
Wow.
That makes me
Fours.
feel really good.
That's
Thank
really
Thanks,
sweet.
Molly.
Thank you.
Absolutely, that's
That's
amazing.
very sweet.
We really appreciate the reviews.
She's proud of us.
I
The
know,
videos,
it's really
two
cool.
videos we're planning on doing
There's two.
that you just.
Oh,
that
yeah.
we just said, right?
Yeah.
Yes.
It's only there's two. What?
Well, aren't we also standing on the side of the
Oh
road?
yeah, we're also
Oh,
gonna
yeah.
do a side of the road thing.
Yeah.
Yeah.
Yeah, we're gonna stand on the side of the road and promote the crap out of the
I
podcast.
thought you were going to say dunk tank.
Oh, we
But-
also
Well, we
tossed around
talked
a
about
dunk
that,
tank.
but-
Yeah, it costs money.
I think we settled on the
We're
two.
poor. We can't do that. We're not going to do the dunk tank. We're trying to save money.
Yeah.
Yes.
So
Oh,
standing on the
God.
road and embarrassing yourself.
Yes.
Yes, I think that's
Um,
what we landed on.
Speaking of the exciting 2 new videos, they will be posted on our social media. So go check us out, Instagram and TikTok at the Veterinary Roundtable. And we also this past weekend had some fun content on there that you've now missed because it expires in 24 hours.
Yeah.
So get up on it.
Yeah.
And you can also set your notifications to be notified when we post on our story or on our page.
I have them.
Wow, I didn't even know that.
I need to do that.
I did that. So I see every time we post.
Okay,
We're showing our age.
Yeah, I know.
But yes, you can get notified so you don't miss anything from the Vert girls.
Yeah, we had a great time, which I'm sure we'll talk about in Pits and Peaks.
Vert.
I know what my peak was.
Supposed to introduce.
I love that people are calling us Vert. I think that's so cool.
Segue
I'm Dr. Ashton Duckwell.
I'm Devin Fortune.
I'm Courtney Allen.
And I'm Dr. Emily King. And we are Vert.
Vert.
Okay, wait. Listen. The magic
I saw
bag.
it over there. The magic bag.
I know. All you people
What a fun
I feel
episode.
like I'm going to cry. I'm so excited.
Buckle up, peeps, because here we go.
Oh, I hear that's heavy. That's a heavy bag.
I got us all drinks.
Oh.
This is one of my favorite drinks.
She's getting out the surprise bag and she's giving us all Propel
was my whole
black
childhood.
cherry flavored
Black
drinks.
cherry.
Propel was
It's
literally
favorite-
my childhood.
favorite drink.
Love
This is
it.
all we drank when my mom would buy these for Zach and I. It was like a special treat.
Also,
baby food at
I
the
got
grocery-
you guys.
So good.
I got. I got you guys animals. They're actually fruit or food. So here you go. This is
Christmas.
read it out loud to everybody.
Loving lemon, you're the zest. You bring sunshine to all.
Oh, look how cute she is.
Okay.
It's a stand.
Did you know that I love like citrusy stuff?
It looks like her
Which
eyes
why
are
you're
watering.
the lemon.
Like my stethoscope is citrus colored.
These are like
What
the
is
positive potato, but fruit.
Yes,
It
but
says
fruit.
You have like
Yes.
tears in your eyes.
Okay.
Your eyes are watering.
Here you go. Ready?
Oh,
Here's yours.
Is it a pear?
It's a pleasant pear. You're perfect, just the way you are.
Yeah, here's yours.
What's mine? Amazing avocado. Pit stop to success. You've guac.
And mine is fine. Apple. It's fine. You're fine. Everything is
Oh my
fine.
gosh, look how cute
Look at this
they
little thing.
are.
It's got a little smirk on it.
Yeah, it does.
Should we put
So
them
I
on
have
the
that.
table?
Let's put them on the table.
My throat hurts from that smirk.
Okay.
Sorry if you're listening to
Then-
the podcast with headphones.
The other thing I got everybody was some cookie
Oh my god.
And look, it says 100 reviews.
Did you add the circle?
Yeah, I pretty much did.
Because it was candles and then you just made it.
Yeah, I
It's
pretty
a
much
cookie
did.
cake that says
Wait, I want to
100
take a
on
picture.
it.
Keep smiling. No, wait.
It kind of works because it's 101
Looks
technically.
so-
Look back at me.
What did you add it with? Toothpaste?
Look at our little friends.
It was.
They're all hanging out.
So you added the zeros?
That's amazing.
I wrote reviews down there. Do you see that?
Oh, I did see that.
See that?
I
And
did
then
see it.
and then I changed those candles. I tried to make them into 100s, but my yellows didn't match. So then I was like, fuck it. So let's
Thank
just
you
go
for
around.
making us feel special.
Look at that penmanship.
I know, isn't it amazing? So there we go.
Oh, good job,
Yes,
Kate.
we love
Queen,
cookie
cake.
cakes.
I love cookie
Thanks, Key.
You're welcome. You guys are awesome.
Wow.
I'm so excited. This is the
Wait,
best
do
day
you
ever.
wanna eat it?
What'd you say?
I mean, there's
Eat it?
plates. I'm
Yeah,
sure
we're eating it.
allowed to
We're
eat
definitely eating it.
Yay for food!
Oh, and yay for
Thanks for doing that before we opened it.
And we have one more special surprise.
Stop it.
Stop it. It's
Uh-oh.
true.
Stop. Do we have
for people
a
who-
celebrity
I'm
guest?
scared.
No celebrity
Do I
I need
guests.
to get up my
Hold on.
camera?
You can't see what's happening because it's behind the camera, but
How do you know?
Harrison.
Oh.
No, I'm
Oh.
explaining
Oh, yeah.
everything to them because
I
if
thought
you're
you
not
knew what the
watching,
surprise was.
Harrison just walked out of our studio.
Oh my gosh.
This is
And
when
he's
sweaty
gonna
palms.
come back with something, and I feel like I'm gonna vomit.
I have sweaty palms.
Okay.
Oh my gosh.
I'm
What are you
sweating.
gonna
Are we
get?
getting
I'm gonna get the
iced?
nervous pee.
Are we getting iced?
No, you're not getting
Ooh.
iced. I promise.
Ice would be funny though.
Yeah, that would be.
I would do
fun.
That would be.
I'll
pretty
do it
great.
for 200.
Okay.
I'll bring ice.
Oh, there
Okay,
we go.
wait,
We've
this is
already moved
taking
on
him
to
a
the
minute.
200th
I
review.
feel like I can't breathe.
Duckwall's getting
This is
iced.
taking him a long time.
Where is he? Where
He's
did he
probably
go?
like outside.
He
He's
left.
building the suspense.
He left.
The
He's-
anticipation is
yep.
killing me.
What do we do?
Ding, ding, ding.
Look,
I just want to give a special thank you to our listeners for giving us 100 reviews.
We couldn't be here without you, listeners, and getting the 101 reviews.
Yeah.
Maybe we all get a Dalmatian.
Dalmatian. Oh my god.
If you want the way to our heart, it's food.
honest.
We got Pizza Hut.
Oh,
Everyone,
he's
we got
serving
Pizza Hut.
us. Are those mild wings?
Oh, wow. Wow.
Wow.
Dinner
Wow.
is served.
They got us Pizza
Pizza.
Hut. Oh, thank
Okay,
you.
there we go. All right, Devin's serving. Let's go. Let's do this. Yeah, I love it. It's amazing.
Wow.
Okay, brief little pause here, or we can continue.
Let's go ahead and go into
We'll
Pits and
keep
Peaks.
going, and then we can all take turns.
Pits and Peaks.
Okay, Pits and Peaks.
Okay, I'll go first.
Okay.
Peak was a road trip with my girls this weekend.
That was amazing.
Very last minute. And in the videos, we didn't explicitly say what we were doing, but I'll share it. So I went to go look at a horse that is still not mine. So fingers crossed. I was basically trial run, interview, the whole bit. And he was a big, sweet boy. We liked him a lot.
Mm-hmm. He's very handsome.
But we don't know because it's a big commitment and a big purchase. So I'm going to have him examined.
What's that one, Devin? Okay, yeah, hit me.
Okay. Nice.
Okay.
He was a really handsome boy.
He was a very big, handsome boy. But in the horse world, you don't have to. You can do a pre-purchase exam. So I have a veterinarian down there in the area going to go look at him this week for me to see if he's healthy and, has basically,
do most people not do pre-purchase exams?
I don't know. I think that's the norm.
Is to do one. The norm is to do one?
Yeah. I mean, depending on what you're going to do with your horse, even though I'm not going to do anything crazy, like
what's in that?
He's a family additive. But definitely when people are trying to show them jump, the sport world, show world, 100%.
Right. I mean,
especially with their budget, knowing it's probably way more than what my budget is.
Okay, one of my kids said, maybe it was Harrison, how much does it cost to buy a horse?
And you took it away.
Oh gosh, it just depends. That also, it's very interesting. The horse market is different because it changes all the time. It kind of follows the housing market. So horses, there'll be a surplus and then the prices are low. But then there's times where everyone wants a horse, and that's kind of like right now. So, and then there's the skill levels who you get them from. Okay. It's a whole thing.
So, yeah, I have a little bit of horse experience.
So what's the range?
Well.
What's the range? What's the lowest somebody can buy a horse?
I'm going to go $0 free.
But yeah, rescues. You can rescue horses for $100, even $100, $150.
In my time, we owned 4 horses at once, and they were all extremely different prices. And then there was a horse at the barn that sold for $100,000, and there are horses that sell for significantly more than that.
That's a house.
I would say average is probably barn. $15,000 to $20,000. Would you agree?
Well, for show, for rodeo, I mean, you're in double-digit thousands.
Yeah.
That is
easily
not what I'm looking at.
Yeah.
And so I think on average right now, what I'm finding for the age I want is younger, right? So it's going to be a little bit more pricey. But right now I've seen anywhere from $3,500, so $3,500 to $10,000. I mean, that's the range right now. And that's pretty average for not wanting to do a whole bunch, but wanting a safe, sound, trained horse. So it really
they can go for anything.
Oh, yeah. It's ridiculous.
It's so dependent on...
I laugh at the prices because it's
their breed, their age, their bloodline.
Yeah, the bloodline's a thing.
The thing they do. Their event. I mean, that's what it's called. The event.
It's intense. But anyway, it's so interesting. Yes. I always find it fascinating how it changes and what people want and anyway. So stay tuned.
But it was really fun.
It was really fun.
It was really fun.
So
fun.
Yeah.
Yes. How far away was it?
2.5 hours.
Oh, not bad.
Not bad at all. It was quick. It was easy.
Kentucky.
So we'll keep posted. If it doesn't work out, that's okay. I'll find the one when it needs to happen. I'm trying to be very loosey-goosey about it.
Open-minded.
My pit. I don't know.
Nothing you can think of?
Nothing at all.
Nothing I really need to talk about.
Okay.
Oh, another peak. I'll do 2 peaks.
Okay.
My sister finished chemotherapy.
Woo!
She's a survivor. She had breast cancer diagnosed this year.
There we go.
Yay.
So, and I surprised her last week and when we had the guest episode. But yeah, it was great. She's doing it. She's a strong lady. And she's getting married next week.
That's awesome.
Multiple peaks.
That's so exciting. It's a good month for her.
Mm-hmm.
Or 2 months. Yeah.
That's awesome.
All right, King, go ahead.
My peak was I went to Mississippi State University and visited with all the students there. And that was really cool and fun. And I got to see Mississippi State University, which I'd never been there.
Mm-hmm.
And it's really pretty.
Did you drive?
Yeah. We drove. And
How far?
8 hours and 40 minutes. 8 hours and 45 minutes.
What were you expecting?
I don't know, but
You know, it's like down south.
It was really beautiful.
I bet.
And
That's
it was
so fun.
farmland, and the campus was really cool. The students were really cool, and it was hot, and it was fun. And they had great questions.
Good.
So that was my peak. My pit? My pit.
We're all having really good weeks, I guess.
I don't have a pit either.
I'll
actually have a pit.
Week? Today's Monday, so it would have been last month. Well, I would have talked about it on Tuesday. Talk about dropping Johnny off for school.
No.
Okay, there you go. That could be my
Where's he
pit.
going?
He's at IU.
Boo.
Dropped your baby off.
Just
Yeah. So I'm yes, I miss Johnny.
Yeah.
You have one left.
I know.
Does it
Yep.
get easier or harder
Calvin-
dropping them off?
Oh, it's the same.
Just sad.
Yeah, you got
So
it.
interesting.
Do you cry a lot?
Yeah, I always cry.
Well, yeah, they're your babies.
And I was like, he's like, I'll be fine. I was like, it's not that you won't be fine. Now you're gonna be fine. I was like, I just miss you. You're a good person.
You'll be fine, but I won't be fine.
Heck, I could probably cry if I think about dropping Helen off right now.
my
She's
God.
a year and a
Yeah.
half years old.
Yeah. So
Mama heart hurts,
Yeah.
but it's also very proud.
yeah.
Yep.
So and I'm going to get him today because he misses his girlfriend. So I'm going down to get him and take him
shut up.
When are you going to get him?
Because he misses
After
his-
this?
It's
Where
not
does his
just like
girlfriend
a-
go to school.
Purdue. And don't get me started
Rivalries.
about
My
why he's
gosh.
at IU instead of Purdue. I have no
Wait,
idea.
so he doesn't have a car, so he just
No.
needs you to.
So I need to go get him because he texted me and said, "Is there any way, LOL, you would come get me?"
Oh my gosh.
And I was like, "Yes, I will come get
Oh.
You're such a good mom.
So-
He should have said he actually missed you.
you." I know, but we all know.
He'll learn.
So are you just gonna like
Yes,
wait for
so,
them
like,
to like are they gonna hang out and then are you like taking him back tonight?
No, I'm just bringing him back to the house. I think he's just driving down there. Like when he
Oh,
gets to the house,
gotcha.
he's just taking the car and
Oh,
going
Okay,
down
I
there.
thought you were driving from IU to Purdue.
Yeah,
No.
that's what I thought too.
No, but he's just coming back to our house, and then he doesn't have class until midday tomorrow. So I think he's just going down there and then going back to IU.
So next time,
I don't know. I got to figure out how to get him a car there. So on the way here, I was
Mhm.
looking up, can freshmen take cars to IU on campus? And
Usually
you
they
can.
can.
You can. You just have to park in the lots
Really
like
far.
near Memorial Hall
Like,
or
really
whatever.
far.
Or yeah, you have to park far away.
Yeah, so I'm like, well,
Get
I
to
mean,
step in, boy.
that's
You want a
right.
car.
that's right.
Mm-hmm.
So anyway, there we go. Those are mine.
Okay.
You want me to go?
Mm-hmm.
I also have two peaks.
Yay.
My first one would be this past weekend. What Duckwell already talked about, because it was like our drive was so much fun. And it was literally 24 hours, like heads up. Actually 12 hours probably.
Yeah, I was like, you guys want to go with me? Okay.
Yeah. Um
Yeah, I'm
Yes.
okay. At work.
I was literally like
lunch.
on my way out to check out a patient or do something. She's like, "You want to go to Kentucky?" So I went. So it was just really, really, really fun.
Yeah.
Because I was thinking about not going a little bit because I had an event that night and I didn't want to be late, but I'm really happy I went. My other peak, which I haven't gotten to talk about because we did our guest episode and whatever, but my tattoo.
Oh yeah.
My tattoo is done.
Your tattoo.
If you are watching, if not, I have my dog's ears tattooed on me. So I have Sir Jeffrey, who is my heart dog, who passed almost 2 years ago, and then Miles, who is like my first dog officially on my own with my husband. So I got my two boys on my arm with me, and it's very, very special. It will be 2 years next month.
Yeah.
Wow.
Wow.
Yeah.
Can't
So
believe
yeah, I'm really happy about it, and I'm very happy I did it.
It looks so good.
And it didn't
Thanks.
hurt at all.
And it
right?
didn't hurt at all. The
She
build
was
up
so
is much
scared.
worse. Granted, this area is not too bad. And then my pit is too hot.
Mm.
Yeah, it's another heat
It's
wave.
way too hot outside.
It'll get cold again soon.
That's
Yeah.
my pit as well. I do not do well in the heat.
Mhm.
It's so bad. Yesterday I walked outside to like walk a patient for a minute. Sweat literally was dripping down my back.
Yeah.
It's so
Wow.
bad.
And
I
then
do
your
not
pants stick to your butt.
do well in the heat. I get so overstimulated. I get so frustrated. I hate it.
I will say the clinic's very cool, though. I had to put on a jacket over my long sleeve.
Treatment is not cool.
No?
Everywhere but treatment, I think.
I would much rather be hot than cold.
But then again, the doors are always opening in treatment, so.
It's true. A peak. Dare I talk about it? It's been a little bit since it happened, but Walter and I's trip.
Oh, yeah!
Well, I said that I would talk about it on the podcast, and I really kind of talked about it in the video that Harrison posted, but it was really fun, and he did really well, which I was pleasantly surprised by, because at home, he's an orange cat. He's kind of a menace, but he was really well behaved, and I think he had a really good time.
If people didn't see the social media, where'd you go? Where'd you take the cat?
I took him to Cuyahoga Valley National Park in Cleveland, Ohio. It was about a 4.5-hour drive, and he did fantastic in the car. He slept on my lap almost the whole time.
That's awesome. What I think is great.
Yeah.
A lot of cats get so stressed.
I didn't expect that. And then I have a stroller and a backpack for him, and he spent so much time outside, and it was super enriching for him. I think he had a good time.
Yeah.
He was super tired when we got back.
Was he?
He was slept the entire week, but I think
it's so cute.
But then the next day he was meowing at the door when he go outside. So I think he had a good time.
Oh,
not many people can say they took their cat on
a hiking trip.
And even with people coming up to the backpack or the stroller and saying hi to him, he did really well.
Oh, good.
Yeah. No hissing. He might have hissed twice the entire trip. And it's when I was putting him in the backpack.
Yeah, that's amazing. That's really
and
impressive.
And Courtney knows Walter.
Yeah.
He can be spicy.
Yeah.
So I'm proud of him.
Yeah, that's pretty amazing. That's awesome.
Very cool.
All right, is that all we got?
Oh,
yeah.
Okay.
Good.
Ooh.
Trending veterinary topics. We don't do this every podcast, but when there are hot topics, we jump on it.
We cover all of them.
Yeah.
Rabies outbreak at rescue event.
Yeah, this is kind of crazy.
You guys see that stuff?
Intense.
Someone recap. What happened?
Ooh.
There was a litter of puppies at an adoption event trying to get homes, and 1 or 2 of them tested positive for rabies.
They were all exposed to rabies.
One of them tested positive.
Yeah.
After. And but they had already had the dog for months, I think. So they're having to do a lot of tracing to see, because the dog had been at a lot of events where there wasn't appropriate PPE worn. So there's a lot of tracing going on. This was based in Colorado.
Yeah.
Yep.
What's crazy?
No, a family adopted one, right?
I think so.
And then it got home, and then it was acting funny, and then it ended up being euthanized. They tested it. It was positive for rabies.
Mm-hmm.
They traced it back to the event. And then I think they ended up euthanizing the whole litter.
The whole litter.
I know they recommended it. I didn't know if they ended up doing it.
No, they did.
Yeah. And then there was a second dog in the litter that tested positive.
It was because of the quarantine was difficult too, and all of that. Which,
you had to quarantine them for at a different facility for 120 days, I think. Or euthanize them
100 something. But I mean, the public health risk is
too great.
It's too great. It's a fatal virus.
You don't mess with
humans.
That. You don't mess with rabies.
And it can be through bites, open wounds, scratches. Yeah.
It was crazy.
Yep. So it's sad. It sucks. But it is a very, very scary disease. And if we're exposed, if we get, usually most people going into school get your rabies vaccines. And the titers last quite long. But if there is exposure post, right now it's been for me multiple years of getting the vaccine. So if I were to get exposed, I'd probably have to get a rabies booster, restart the series or something. So I haven't checked my titers. So
I have not checked my titers in 20 something years.
I do know it lasts long, but I don't know if it lasts long.
Yeah, I was going to say, someone tells me it doesn't last 20 years.
I know it.
I mean, thankfully, most of the patients we are involved with are vaccinated.
Yeah.
Still, risk is not 0%.
I know. I kind of want to get vaccinated, but it's super expensive.
It is. That's the other. And it's a 3-part series.
Yeah.
So it sucks.
Does Penn Foster pay for you to get it?
I don't know.
IBC did, but
I was going to say, because the schools usually do it for free.
Yeah, I got mine going into vet school.
Yeah.
IBC offered
I don't know.
You'll have to find that out.
Yeah.
Because I would get it.
Yeah.
You probably should.
Yeah. Just so I don't have to worry about it. Would I still have to go to the hospital if I get bit by a cat?
Yeah, that's for antibiotic.
That's just infection.
That's cat scratch fever and everything else.
Yeah.
Nothing to do with rabies. That's not why they send us to the hospital.
I get bit. I had to get my tetanus boosted when I went.
Yep. Okay.
Well, moving
craziness.
Sad.
And that's a very rare occurrence.
It's so
not
rare.
something that's going like.
No.
I mean, the episodes of canine rabies in the United States is so rare.
Yeah, but what do we read in the article? It was 95%
of the 70,000
people.
Deaths,
yeah,
right?
yeah, are from rabies.
Rabies.
That's insane.
Dogs. Rabies. No, rabies. What did it say?
I don't remember if it was dog. It was dog. It was canine rabies.
Yeah.
Mm-hmm. Did you guys see about the bubonic plague in a rat? But I don't know. I saw a video about how a rat somewhere in the U.S. has the bubonic plague, but apparently it's relatively common. Like we have a few cases a year.
Isn't that Yersinia, whatever, or something?
Bacteria or
that
something?
Bacteria.
Does that make boils and stuff on their skin?
Don't live with rats. Let's just say.
Rats are so cute, though.
We see rats as patients.
We neutered
now.
a rat last week. It's so cute.
And then he came back the same day for chewing his incision.
Yeah.
Oh, he did?
He was so big.
Rats have huge testicles.
He was a fat rat.
Yes.
I forgot how big their testicles were.
Yeah.
I like cat testicles.
Yes.
Oh, no, little rat.
Rabbits also have huge testicles.
Yeah.
Rats just
big balls.
It makes me uncomfortable.
Rats?
Yeah.
Or testicles.
I wish their tails had hair. I don't like the naked tails.
Yeah.
Or they just don't have tails.
Yeah.
That'd be good.
No.
We can start cropping talking rat tails.
Give them a nub.
It's a hamster.
They just need a toupee on their tail.
Okay, next topic.
Yeah.
Moving on.
All right. FDA confirms Purina foods are safe.
Did you hear that one more time? Maybe run it back one more time. They're safe.
Yep.
FDA confirms safety of Purina pet foods. Even with the FDA's study and everything, there's still people who are like bashing, I think, Purina, right? Isn't that
it's a fun thing to talk about? Why not?
Yeah.
So, but they did, I mean,
they did studies. It was negative for a slew of things.
Mm-hmm.
They tested open bags of food, closed bags of food. I mean, they did everything.
Yes.
Open bags from owners, closed bags from retailers.
Yeah.
I will say though, and we hit on this a little bit before the podcast, but I will say that social media definitely stirs the pot. And so because I'm a veterinary professional, and I'm not going to lie, I panicked a little bit when I saw the accusations against Purina because my parents' dog is on Purina. And so I did panic, but then after doing my research and talking to people I work with and things like that, I was calmed down. But I definitely don't think social media helps. So don't always see or believe the things you see on the social media.
Yeah.
Do your facts, fact check everything.
People have different vendettas as well.
Yes, don't just click on a random website. Make sure it's an accredited website and whatnot if you really want real information.
Some people are bored and just starting things.
Even if you don't want to feed your pet Purina, that is fine. But don't go on this train of it's going to kill your pet.
Fear mongering.
Yes.
Yeah, I think that the conclusion was that there was no direct or consistent connection between the wide range of adverse events submitted to the FDA, and the evidence does not conclusively link the reported adverse events to Purina pet food.
Yes.
So, and I think there's a difference between causation and correlation.
Mm-hmm.
Mm-hmm.
Like people get that confused all the time.
Yes.
We were talking about Librela, Librela getting blamed for the
X,
death
Y, and
of
Z.
a 18-year-old dog who has kidney disease, hepatic disease, and everything else disease, and they give it Librela and it dies.
Yeah.
And it's like, okay, what about the 4 other things that the dog had?
Yes.
Yeah.
So,
Right.
So, it's one of those things.
Right.
Yeah.
Well,
You only can do so much, but we're here to give the truth.
Mm-hmm.
We are here to speak the truth in a funny way.
Yes.
All right. Listener inquiries. First one. Our vet went above and beyond with our pet. What's the best way to thank her for working so hard? Anonymous.
Give her food.
Oh, wow. That's a really great question.
Smart.
We have never had that question before.
We have not.
Your tongue is so
We're
blue.
not. What is
so as a veterinarian, what
what
do you think is what do you love when people do?
I have, since the day I started, I have a huge pile of the notes that I get from my owners, and I just love them. I mean, even if it's a card that doesn't say much, it's the fact that they went above and beyond and out of their way to address it to me, to write whatever they chose to write or include a picture.
Yeah.
I have just, those are, and someday I'll probably go back through if I'm having a rough go of it in the industry. I'll go back and pull some out and read the letter, or, if I think about a family or something like that. But I personally like words of affirmation and just nice sentimental words and handwritten notes. That's for me though.
Yeah.
I'm not a vet, but one of my clients the other day, so she had rescheduled her appointment a numerous amount of times. And then when she did come in, I was not available. I was with a patient. And so I had our tech team go out and do the appointment for me. It was just Librella. And then they were like, well, she has a gift for you. So then I went out there and I said hi to her. She got me a plant. Like, that's a thoughtful gift to me. It's not just like, I don't know. I don't know. I think plants are very thoughtful gifts.
Yeah.
And like sweet. Dr. Pulse, a doctor we work with, Devin and I worked with her for a few months while Duckwall was on maternity leave. And she got us plant. Like, she got us flowers from her garden. Yeah. Like, I think that's really sweet. Like, it's more thoughtful than going out and buying a little gift basket or something. Those are still appreciated.
That's what Courtney said. What? It's from One Lick of Icing. My mouth's bloom.
Yeah.
They're slices.
Guys. But I also like notes and cards. Those are very sweet.
Yeah. I really like notes. And then I have one client from a little while back that stuck with me and she made me a little gift basket. Yeah. It was really sweet.
It was really sweet.
And then we have one who gave us the pictures of the dog throughout its life. That was really sweet.
That's cool.
Yeah, that was really cool.
It was really sweet. But yeah. I would agree with those.
I think the words of affirmation are always great. You know, I think that when they acknowledge, like, when they start to understand the difficulties of the job, and then say something about that, is always really meaningful. Like, you know, it's like, we get it kind of thing, you know, like, we know how hard you're working, or we know that this can be sad for you too, or we know that, you know, like, whatever it might be. I'm like, oh wow, okay, yeah, they really do get how this all works, you know, and how you make it a meaningful relationship, you know, and whatnot. And so, yeah, I mean, I think all those are great ideas.
Yeah.
For sure.
But we do have a lot of clients get us food.
Yeah, food's always great
like
too.
Cookies, cake.
They're gone
pizza,
so fast.
Literally.
Yes. Yeah. That's very kind.
They might last a few minutes.
Okay. This next one, is it the 2 paragraphs or just this one and then there's a separate one? Okay.
Yeah.
Right? They're different? Okay. I read that first one. Kingling, go.
Hello again. I recently sent a message about medical SOPs in animal shelters. I didn't really realize I could leave my name. My name is Brianna, and I am a recently former client of All-Star. I saw Dr. Duckwall among other veterinarians, and I'd like to give you all a big thank you for the part that All-Star played in inspiring me to pursue a career in animal care. And thank you for your great answer. As a follow-up, I wanted to ask this. How would you talk to someone who has had an animal pass under strange circumstances, or who has been traumatized by an animal's medical event? Personally, I have had a fairly traumatic experience with a foster animal of mine. His death was unusual, and that left me with a lot of questions. I feel like in my profession, once an animal is gone, there's not much more we can do to understand the situation. This left me feeling very insecure with my abilities and questioning what I know about animal care. I know that some of our foster parents have had similar experiences, and now that I've come to know how confusing it is, I'd like to be more equipped to help them through it. Are there any ways to help people cope with losing an animal and not being able to explain exactly what happened? I'm not sure how well this question translates, but I wanted to be able to support our foster families any way I can, so I figured I would ask. Thank you.
That's a great question.
Great question too.
I have personal experience with this, actually. It just recently came back to it resurfaced, I guess. It's not the exact same, but I had a client who I worked with for a year and a half. And we are very, very close friends. Well, we're close. And she had a pitty who had some behavior issues. And so I worked. Ow!
Are you okay?
Those are real forks.
Harrison is literally throwing utensils at Devin.
Plasticware.
And basically about stabbed her eyes out.
That was a sentimental thing. Okay, continue. Feel how heavy that is.
I know, it's a real. He doesn't have plastic. They're all metal.
Okay, I guess only 2 of us could afford.
Good thing the TVs are broken.
That's
anyway.
Okay.
Did I hit the TV?
In my hand.
Okay. But anyway, I had a client who, like I said, had a fear aggressive pitty. And she got her from a very, very bad situation. But she really wanted to work with her and get her more comfortable with us at the vet, blah, blah, blah. So I worked with this dog for a year and a half doing happy visits. And And she would come in. The owner would already bring her muzzled because I couldn't get anywhere near the dog. I could barely take the leash from the owner. And we worked, like I said, for about 1.5 years. And then this dog ended up biting someone in the complex she lived in, and the owner had the dog put down. So that killed me because I worked with the dog, and I finally got to the point where I could take her muzzle off and pet her. Anyway, she had to be euthanized due to behavior. And that was in 2020. And the owner actually just reached out to me recently, and we actually are neighbors. But she finally was ready to get a dog. And so I think it just takes time for everybody. Like, even if you go through a weird situation or it's unexplained, I think everybody grieves differently. But I also think it's helpful to tell the owner, like, they did everything they possibly could. Which sounds cliche, and maybe some people don't want to hear that. But I think it's helpful to tell people that you did what you could. You gave the dog the best chance they had. You gave them the love they needed. And you were a part of their story. And they couldn't have had the last week of their life or something like that, like with you. So to make them feel like they did something, I think is really helpful. Because I went through something too, like Amari. I fostered a dog from the clinic, and I only had her for a week before she died. And it was helpful to know, like, I just kept telling myself she just had the best week of her entire life. Like, we don't know what's wrong with her. She was a stray. But I literally gave her the best week of her whole life. And that's what I tell myself. I don't know where she came from, but she was malnourished, and she got to sleep in a king bed with my husband and my dog and I. And she got to eat whatever she wanted, and she had a roof over her head. And so that's what helped me get through my foster dog passing.
I think I find there's more of a struggle when I talk to owners with a traumatic passing or a traumatic correlation or disease that led to a passing, as opposed to the not knowing. And I think there's probably different reasons for that, especially if I've known the owner or the patient throughout the animal getting sick. And if we felt like we were open, honest, and communicating really well, it didn't necessarily mean we needed to find the answer, which was okay with the owner. So I think those processes are not easier to walk through, but having that relationship is much different than where a patient died traumatically and it's literally out of your control. Or the biggest thing I find is owners are so scared for the next pet if something like that could happen again. So walking through that type of trauma with an owner is just honestly trying to show sympathy, empathy, and walk through and be like, okay, this was the scenario for that pet. It got hit by a car or something like that. It's going to be more of a traumatic grief to process. So it's going to be a lot different, I think. But the best thing is you're supportive. You're there, and you're like, just because that happened with that patient or that pet, that doesn't mean it's going to happen. This is a whole new life, a whole new scenario.
Freak accident.
Exactly. Yeah. But I feel like I have that conversation quite a bit, where an owner said they had I don't know what happened, but the dog got vaccinated and then the dog passed, hit by a car, gave a medication, it got sick. Something like that, where some things are easier to explain away, but some you just have to be like, I'm so sorry that happened to you. But that doesn't mean it's going to happen again.
Yeah.
I don't know. I don't know what other way you can comfort someone through that, because
they kind of just got to go through their own grief too. And you just have to be there to support them in whatever they need.
I think she talks about, like, having questions, so his death was unusual and left me with a lot of questions. Like, I think there are lots of situations where, I think just in medicine in general, whether it's people or in animals, that sometimes you don't have an answer. Like, there are times where you'll uncover every rock and you still don't have an answer. And, that's really hard to accept a lot of times. And I think that, they're really, I'm not a therapist or anything like that, but I think depending on what the source of trouble is, talking to somebody to try and help you, let them help you figure out tools that you can use to better manage those feelings so that you don't turn it into something that it's not supposed to be, so that it doesn't become something that it didn't need to become is really important.
Yes, or it's projected inappropriately or shoved down.
Yep. And then it comes back later and it's, a bigger problem for the person. Yeah. But I mean, there are definitely cases where, and I don't know if I really understood that when I got out of school. I think I assumed we would have an answer for every problem. Like, because that's kind of how you learn is there's always an answer at the end of the road. You always are coming up with an answer. And it's just because of how they're teaching us. Yeah. I don't think we ever discussed doing all these things and not having an answer, which happens a lot in freaking cats.
Or acknowledging that you may not be able to fix something. You can't fix everything.
Yep.
So I think just being there listening, even if you can't 100% relate, it's still going to be helpful.
Yep.
We had client really good clients that had a 2-year-old Shih Tzu pass away with the weirdest disease process that happened. We still don't know what was wrong. They came back over a year later with a new dog, and I literally talked to them for over an hour just to ease their minds that it was so different.
Yeah.
And we didn't have an answer, and it was traumatic, but you have to work through it.
And then she says that she had a personal experience of a foster dog of her own or animal, and that she's feeling insecure with her abilities. I don't want her to feel insecure with her abilities because you're genuinely doing everything you can. I don't know what her position is in the shelter. Do you guys remember what she is?
I went through the same thing.
Yeah, with the SOPs. I think everybody has. Yeah,
and animals are so good at hiding their emotions and their symptoms and what they're feeling. So, yeah, I'm sure that you did every single thing.
Yeah, it doesn't mean you're dumb. It doesn't mean you missed something. It doesn't.
Yeah,
I went through the same thing, and I couldn't save the dog, but you can't save them all.
Yeah,
and you have to also understand that.
Yeah.
Well, I think if you approach those situations I think it's fine to look at those situations and go, okay, where can I be better? How can I be better the next time? Because I think that's a very constructive way of working through the process. And I don't think there's anything wrong with looking at a situation and going, oh, I missed that. Or maybe I could have done this better or that better. Because I think then if you put blinders on, then you're not going to be better the next time for the next pet. And so focusing on being better for the next pet and the next pet and the next pet is really, where you can put your time and attention.
Yes.
Okay. That was a great question. All right, next one. Hi, friends. Hope all is going well. I just finished my first day as an RVT student, which is so exciting, but the nerves were very high today. I love listening to the pod and have been here since the very beginning. I'm curious to know what school tips advice Courtney and Devin have that made them successful. Sending you all the good vibes from your California friend.
Woo, woo, woo.
Cool.
That's amazing.
First of all, congratulations.
Yes,
that is so exciting.
So fun.
Shoot, I don't remember what I said.
So school tips, advice. I know I've said it a lot on here, but working at a clinic while simultaneously with school has helped tremendously. I don't think I'd be able to be a successful tech if I weren't at a clinic. And I wouldn't have been able to just get my degree and then go
start to work or something.
Do they have to teach you textbook in school? I'm trying to back up and explain yours, but they have to teach textbook in school, which is completely normal. And that's how school is. It goes by the book. But in an actual clinic setting, in real life, it's very
on the job.
It's like a whole 360 from school to on the job. It's very, very, it's intense because for example, in school, when we learned how to do x-rays, every patient was sedated. That's not the case in clinics. So job shadowing and everything like that, which we've harped on.
Take your time. I'm sure every teacher has always told you that. But do the extra little activities like the optional homework assignments or the flashcards or the Quizlets or the PowerPoints. Always go the extra mile. Or I guess she's already successful. So, what have made us successful in work? I have a hard time of trying to be perfect at work. So I constantly have people telling me, you'll get there, you're a rookie, just take your time. So swallowing that pill has been very important for me. So I guess know that you will get there eventually and you don't have to know everything and be perfect off the bat.
Yes, and we have that saying on our wall in the doctor's office.
Which one? We've got a lot.
About the pursuit of perfection is the enemy of progress.
True story.
So that's a really important one.
Yep.
I don't know what school you're going to or what kind of college you're set up for. Because mine was very, very fast paced and it was crammed into 18 months of schooling. Make sure you have a good balance. I mean, I know college is intense as it is. And it's very easy to get lost in it and make that's the only thing you do. But make sure you make time for yourself too. Make sure you're checking in on yourself and you're happy, because if you consume yourself with all you do is school, you will be unhappy, I think. So make sure you're making time for yourself still, because that's very important.
Try your best to not work outside of work.
Work-life balance.
Yes. Cut that off and have your evenings to yourself and your weekends, and try not to do what we all do.
Mm-hmm. Love it.
Great.
Those great advice.
Yeah, absolutely.
Oh, set up your financials really well.
Yeah.
Yes.
That's a big thing.
Check out Dr. King's video.
Right.
Granted, that's vet school, but check it out.
Still dead.
Applies.
Yeah. Mm-hmm.
All right.
That's all I got.
Texting thing. It's all you, Courtney. She took a big bite of cookie there.
Mm-hmm.
I would try.
Our texting servers, which I still haven't made a video about because I'm a slacker. Our text message feature on our for our podcast. Whatever provider you're on, once you click the link to like our channel itself at the top, it has a little link that says text us here. You can text us messages. It can be questions or just chit chatting if you want. And then if you would like a shout out on an episode, leave your name. Otherwise it will pop up as anonymous.
Okay.
We
all
love
right.
those.
Boom.
Names.
That was
Taste
a little choppy.
collections.
Ooh, I want to go first. I like my
Go
case.
for it then.
Dang.
Okay.
Somebody's
So
eager.
I like this case. It's so fascinating. So I have a 2-year-old domestic short hair male neutered cat, and he was adopted a month prior from this family from one of those cat cafe adoption places. And he was doing great. And then all of a sudden on a Friday before the weekend, they noticed he was acting weird and his eyesight seemed to be off. I examined him on Monday. Cat is completely blind. Well, I shouldn't say completely, but mostly blind. And you can just tell the moment you walk in, the pupils are huge, very dilated. He's walking just very docile, very cautious, smelling everything first. So instantly, one of the main things I remember from school is you got a blind cat acutely, you take a blood pressure. So I briefly looked at the eyes, but I didn't want to work him up too much before blood pressure. So Courtney did the readings and average was about 200. It's not astronomically high that I've seen before in a blind cat, and he was in a clinic. But the last thing I would want to do is if it was hypertension causing blindness and not treat it, I would do a disservice to the patient and the chance of getting eyesight back. So after we got the blood pressure, I examined the eyes more thoroughly, and I haven't seen many detached retinas, but I was very concerned that there was partial detachment because I could still see a good reflex of the tapetum. So, and the optic nerve, like there wasn't any hemorrhage, and I didn't see any granuloma type things in the eye, but I'm no ophthalmologist. Ophthalmology and cardiology are both very difficult, I think. So shout out to those specialists.
Yes.
But I did the best that I could. And I was like, okay, there's only so many things that can cause acute blindness. So I'm going to treat the hypertension. I'm sending out all these infectious disease panels because it's a 2-year-old cat. And then he did have a corneal ulcer in the right eye, but the cat was so spastic towards the end of treatments and testing and stuff that I didn't stain it, but the characteristics of it, I started antibiotic eye drops for that. So what I did is I sent out a basic full blood work panel, a urine, and then it's an infectious disease panel that looked for feline leukemia virus, feline immunodeficiency virus, toxoplasmosis, coronavirus, and cryptococcus, I think. Yeah, I think it was that one. So that was on a Monday. I checked in on Wednesday when I was back in the clinic. All his blood work showed was increased globulins.
Oh.
Uh-huh. And he was FIV negative. His urine was pretty boring. So that told me I could rule out kidney disease, liver disease, kind of other weird stuff, I guess. And then he was positive for coronavirus. So
how high was his globulins?
It was just 6. but that fits with the positive corona titer. However, there's like 80 to 90% of cats will have a positive corona test, whatever, if you test them. It doesn't always mean it's going to turn into FIP. However, you've got a cat with clinical signs. So what I did is I called some specialty centers to see, talk to the ophthalmologist, and then also discuss, like, do I need to refer? Is there something I need to do for this cat while we're sitting on it and waiting for the other test results? Well, one of the ophthalmologist departments told me that it probably was not coronavirus. That would be very rare. It probably wouldn't be the problem. I said, okay. But then there was another ophthalmologist closer in town that I called the owner. I was like, why don't you just still go and basically allow them to look at the back of the eye. And that way, one, we can make sure I'm not missing anything.
Right.
And two, there's no other treatments we need to do while we're waiting. So they went. It was the next day. It was great because the cat wasn't getting any better with blood pressure meds, which is also another thing. And the ophthalmologist agreed with detached retina, the corneal ulcer. So I was like, yes. And then they actually said that it was probably FIP as the main cause for the blindness. So I got the records, and then we ended up getting the rest of the results, and the cat was negative for toxo and crypto. So I'm like, well, guess we're going to treat. So now Stokes Pharmacy has the medication, the pill.
The black market drug.
Yeah.
Isn't it super expensive?
Yep. So I just yesterday, the owner was like, yeah, let's treat, because there's, 85% of cats will respond. They may have relapses in their life. But
it's crazy.
The other option is nothing.
Right.
So I called it in. The price for this cat, they just needed one 50 milligram tablet once a day for 12 weeks is the protocol. $1,460 or $16.60. That's with shipping to the client. So I had no idea how expensive it was the first time.
Yeah.
And like I said, I was like, I'm so sorry, but the other option is you go on Facebook Black Market, try to figure that out.
Probably just as expensive.
Yeah, exactly. I have no idea how to help you.
Like, you will take this pill.
Yeah.
It's $1,000.
Right?
Oh my gosh, can you imagine?
Yeah.
So they were going to talk about it. I am not in the office today, so I don't know what they elected to do.
That's awesome.
And it's still like 50-50 on eyesight, I'm pretty sure.
Can FIP present at any point in the life?
Yeah. Well, I mean, it can change into
FIP.
It mutates into the wet form or the dry form.
Fascinating.
But they've had really good results with this drug.
Yeah, I guess I was going to use a different case, but my case can kind of just like spin off of yours. I actually just did recheck values on a cat that had gone through FIP treatment.
Yeah.
We do blood
with the black market drug.
Mm-hmm. We do blood and urine every 6 months, and still has lymphopenia. Is that elevation?
That's low.
Okay, so lymphophilia? No, wait, what is it?
Lymphocytosis.
Okay, I'm learning, guys.
No, it's good.
Yeah,
okay,
you're doing great.
Lymphocytosis. I don't know what the exact value is, but it's still moderately elevated. Down a little bit from the last one, but he's probably gonna have high lymphocytes for ever, maybe. And then all of the other stuff is unremarkable, so he's stable.
Okay,
that's cool.
Yeah. So there's a 85% of response is a good percentage to where I would say.
And the cat is completely fine at home, like no symptoms whatsoever.
I wonder what happens when you treat them for just like a month. If you're like,
well, that's what I was like.
Can I like,
do we just do 6 weeks and see and cut down the costs
and like,
because it says the information is like you need to weigh the cat each week so you can adjust the dose even.
Okay.
But if you get 15 milligram tablet, how does it adjust it out?
It's bad.
Right, exactly. So, I mean, I just told him you can weigh him at home and let me know. But because there's a dosing range for the ocular, there's different dosing ranges for neurologic, ocular, wet, and dry.
Well, that should be interesting. I think I heard someone talking about that this morning.
Yeah.
And it kind of sounded like they went forward and got the meds, but I can check when I get to work.
Okay.
Or go back to work.
And they stopped the blood pressure med because now we know it's not the blood pressure.
Yeah.
Wow.
That's interesting.
Wow.
Good case, I know.
Can't roll out anything.
That's a very
great job.
Well, it was great because you had like all these things, like little feathers in your cap that kept like pointing you towards, you know what I mean?
And so I was stressed that day. We were behind. This cat was very blind and stressed.
And I was very blind.
I don't look at the back of the eyes that often when they're blind. But I was really proud of myself.
And the cat was like, as you should.
I was like, I think this is a detached retina. Haven't seen many, but I think this is what it is.
That's amazing. That's awesome. Great job.
Thanks.
Mm-hmm. You want me to go?
Sure.
So I'm just going to give an update. If you've been listening or following the podcast for a while, you probably know about Mr. Teddy. He is our 8-ish year old golden retriever who we diagnosed with lymphoma almost a year ago. So he went through our CHOP protocol at the clinic. So we did chemo on him. And then he did pretty well. We put him into remission. And then not very shortly after he was done with his chemo protocol, he came out of remission, and relapsed, and his external lymph nodes became large again, or prominent, I should say. And so we had to rescue him with CCNU dosing. We did that. That's what the owners opted to do. So they did that at home. So he comes in every 3 weeks every 3 to 4 weeks.
It's every 3 weeks for blood work before they give the chemo, and then a week after they give chemo. Yeah.
Yep. So his CCNU dosings at home are about 3 weeks apart. Comes in for blood work to ensure that they can go forward with the dosing at home, to make sure there's no infection present, things like that. And then he comes in a week after the dosing to recheck a CVC to make sure nothing is detrimental there. There's no serious changes. So he's been coming in for that. He's been doing he actually handled the CCNU really, really, really well. He was doing great. And then about a few weeks ago, the owners are like, yeah, he's kind of acting a little bit off. He's not really acting like himself. His appetite's not great, which he's been a picky eater, kind of. He was throughout the CHOP protocol, not as bad. They just had to add in food toppers here and there, like chicken or whatever. And they said he won't touch dog food. It's all human food now. He's not eating. And sometimes he'll even go without eating at all. And then the dad mentioned to me that his breathing was getting kind of funny. So he was getting winded really easily. He was coughing, things like that. And then he started having some GI upset, which is kind of an expected symptom from CCNU, or it can affect dogs that way. But he had been handling it up until that point. But anyway, so this past week, his dad brought him in for his last CCNU dose and just told me he wasn't doing well. Oh. And his lymph nodes are very, very large, and he's not doing well. So, oh my goodness, sorry.
Okay.
It's hard when you've been with them for all those treatments,
So we decided to opt out of his last CCNU dose and just keep him comfortable. And the owners are going to euthanize this week. So just an update.
Yeah.
It's going to be a rough one tomorrow.
Yeah.
I'm glad it's at the end of the day.
Yeah.
He's I mean, you guys have done a great job by him. You've given him more time than anyone
which we've talked about Teddy, his diagnosis, he was stage 5 lymphoma, and it had metastasized everywhere in his body. So we got a year out of him. So it's just,
and they're
get attached to the owners.
They're great people. I mean, the whole thing is,
I think that there's been lots of times where you get that people love their pet and all of that, but there are these unique situations, I feel where you can feel the understanding of what the human animal bond has done for the people, and then the respect that the people have for the pet. And it does, you talk about that and you're like, well, everybody's that. Well, no, it's just really interesting where you come across some of those families or situations where it's it's palpable. It's just a different kind of feeling.
Or they've made an impact in your life in some way throughout the whole process and the journey. You're just, something can come from it that's still good and valued, but it ultimately, is good. It ends.
Yeah. It's one of those things where you can't avoid it.
Yeah. At least for this, not for the family and our friendship and everything. I mean,
oh, for sure.
But
yeah.
We just love Teddy. He's a good boy.
He's a good dog, good people, all of that.
My heart hurts for Teddy, but it hurts for his parents too.
Yeah, for sure.
Yeah, but just an update. So pray for Teddy's family, please.
Yep.
Keep them in your thoughts. Do you have a case or no?
I do, but mine can wait till next week.
Yeah. Okay.
Because because then I'll have some answers.
Let's change the mood a little bit.
It's Cooper King.
Oh, I've got answers.
Oh, you do? Okay, we'll wait till next week. Okay.
All righty then. Listener question. Hey, Vet Roundtable, vet student here. I love you guys and listen to you all the time on my long commutes to out to Largy's practicals. I was wondering if you could speak on new graduate experiences, internship, GP, specialties, etc. I know there's tons of conflicting experiences and opinions, but I'd love to hear from you all. Thanks. Lots of love. At Amity. A-M-I-T-Y.
Amity.
Amity. Amity.
I don't know.
Amity? I think that's right.
Okay.
Exactly. Okay. I think there's all kinds of things. Wow. Okay.
All-Star is my only experience.
I think,
and it's been fantastic.
I can gather from my classmates who have gone out and done things. That I've got multiple classmates that went out and did an internship to get to a specialty, just an internship. So kind of depends on what you're looking at. I think it's pretty of a blanket statement. Like if you're going to do equine medicine, you really need an internship outside of school. Even if you're going to do GP, it's still pretty much necessary to be an internship. So there's that. And then
is it because you just don't get enough experience in school?
Yeah.
Isn't that crazy?
Yeah. It's just, the
caseload must just be so minimized.
Well, I don't know if it's that. I don't know. It depends on what kind of horses you want to work with too. And if you're going to go into
because you don't see
expensive sport, like you really got to be prepared, right?
Yeah.
So, yeah, I mean, it's highly recommended, but it's also one of those, like, I think unspoken rules. Like you really just need to do it.
Right.
And then definitely if you're thinking of a specialty, you have to do an internship to get into a residency. So, I mean, anything, ophthalmology, surgery,
all
of it. So I think that from what I've heard and what I've seen, internships are difficult. They're hard. It's going to be a hard year. You get paid, but you barely get paid. You're learning. It's new. You're a doctor, technically, so you can make decisions. But the plus side is you have mentors and leaders that you can use as, it's kind of like a baby step outside of school where you can, you have someone above you still approving your decisions or cross-checking and stuff. So that's nice. That's like a safety net in a way. I think it's also because you're at the bottom of the totem pole, you work more. Yeah. You're on call more. You're just kind of the guinea pig for it all. Not guinea pig. You know what I mean?
Yes.
You're just at the bottom. You just have to do everything.
Yep. Yeah.
So that's internships. That's from not my direct experience, but you got to buckle up.
Yep.
Yeah. But it's a year. You can do it. You can do it. And then specialty, I think it's really just one of those where once you get in your specialty, fine-tuning your skills and your knowledge in that specialty because you are going to be the expert of that specialty.
Right.
So I think that's probably intimidating from what I understand as well. But
yeah, so I mean, I think it really depends on what you uncover as you're going through school as far as your strengths, what you are passionate about, what you enjoy doing. I mean, that would drive a lot of your decision making.
Oh, yeah.
Like if you're like, I love eyeballs, then you're going to do an internship and
you're
going to
be interested in putting the time in and learning it and think it's awesome when you do these corneal transplants and stuff.
Right.
So if you have an interest in one specific thing, you're going to be really good at it then.
Yeah.
I do have a question. Do you guys, like your vets friends and whatnot, have you, most of your, like the people that you know, when they go into specialty or they choose a specialty, do you think they know the specialty right out of school? Or do you think most people work in GP or do whatever and then they're like, oh, I want to do that. Like I'm more into that than I am the bigger, like the big picture.
I'd say hands down the majority come from school.
Yes.
And then specialize? Like go straight into specializing?
Yeah.
Okay.
But like this weekend I met someone who went and was a GP for 7 years and then went back and did a radiology residency.
Huh. Yeah.
So like I think you can avoid doing an internship if you do something like that. You can go straight into residency, I think, if you have so many years of GP experience. But I
think it's
the
hard
majority,
to go back.
Yes.
I think that's why. Because you're already in the school mindset. You're just like zoning in.
Chugging along. And
oh, you couldn't pay me enough to go back to school.
Nope.
That's why, like, because, like, my experience, I mean, I'm not a vet, but after being in the field for as long as I have been, I'm very interested in behavior, but I didn't know that when I was in school.
Now, I know that
I think that's cool. I don't know if I'll ever specialize in it because, going back to school doesn't sound like a good time to me. But it's just something that I have found a little niche for. I really like it.
I feel like the people that go out in GP and then go back and do a residency are probably the most well-rounded doctors out there, just from the standpoint of they get how it works.
Yeah,
it's like,
they've seen everything. And then they're going back.
They've done it. They've lived it.
They've been through it.
Yeah, I mean, and so
they've
it's
seen
like
some stuff.
So like practicality-wise, like, yeah, I can tell you this is what's wrong, but let's be practical here. Like, I get it. Like, we're gonna need to do something. Like,
maybe it would help with the stress level too, because they're like, all right, this is really how it goes. Right, this is how it works.
Like I'm not going. I don't know. Yeah. So I think I could see where that could be a real advantage.
I think when you go into GP outside of school, I think it's just different for everyone and your personalities and where you're set up, how you're set up. I think, I mean, I know I've mentioned it before. The first year out in GP for me was really difficult, but I don't really know a way around it for people, because you just have to really dive in deep and you have to just get used to, you have to learn how to be a doctor and make those decisions and then go from there.
It's way different than school.
Yeah, it's just
school can prepare you as much as they can, but they can't really prepare you.
It's just a growth curve. It's a steep one, but just like an internship, you just grind through. You have grace, and you'll get through it.
Absolutely.
So, I think it's just a challenge. It's a challenge.
It's a challenge for sure.
Thank you for the question.
Yep.
Yes, very good question.
All right, thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thank you guys for 100 reviews. Our next goal is 200 on Apple Podcasts.
Oh, so get us there.
200. Duckwall is getting iced. She's already said it.
Or I will ice you.
Oh, okay.